I got voluntarily permanently sterilized and I didn't pay a single dollar out of pocket. And honestly, if you want that, I believe that you can do it too. It's been about a month since my surgery and I'm finally ready to talk about it. I've been thinking about making this video pretty much since I decided to get the surgery, but I wanted to have a full, all-encompassing experience of what it was going to be like before I started talking about it. I think when the conversation about sterilization surgery or getting your tubes tied comes up, there's a lot of fear around it. I think a lot of people that have uteruses that want to get sterilized, they just assume that it's something that can't happen for them. And the reason that I want to make this video and talk about it is because it is very much something that can happen for you. Before I get into all of this, I do have a certain amount of privilege in that I have a full-time job that offers health insurance that I can afford to pay for. Full transparency, I think my health insurance cost me $75 bi-weekly, which is not very much according to what I've heard from other people and what they pay, but I'm also a unmarried and childless adult. So I don't know if that has any effect. I assume that it does have an effect on how much I pay for insurance, but I don't know what the difference is. So that's just my situation. The way that all of this started was probably 6 to 8 months ago when I had my yearly physical with my regular primary care physician. I'm very fortunate that I found a primary care physician who is extremely open-minded and listens to my problems and takes me seriously. The way that I did that was that I went to Planned Parenthood to ask about testosterone, and it's not legal in my state to receive testosterone from Planned Parenthood. So what they had for me instead was a list of resources and doctors who were queer friendly and who would be able to prescribe me testosterone. And luckily the first doctor that I tried was the one that worked out, and I've been seeing her for probably close to 3 years now. So I had my regular annual physical with my doctor, and at the end, she asked me if there was anything I had questions about, and I told her that I was looking into sterilization surgery. So I believe that she's the one that told me that I had the option to get my tubes tied, which is obviously the common procedure that a lot of people know about. But I also had the option to get my fallopian tubes fully removed, which is not something that I had ever even heard of before. At least not like in a voluntary sense. Like I would assume that if somebody's getting their fallopian tubes removed, it's because they have like cancer or a similar issue where it's involuntary. But what my doctor told me is that it actually will decrease your risk of cervical cancer, and it's a lot more effective as long-term birth control versus getting your tubes tied. Because when you get your tubes tied, there is a chance that they will come untied, which essentially means that you can still get pregnant. There is still a chance that you can get pregnant, versus with your fallopian tubes completely removed, it's basically a non-existent chance that you can get pregnant. Obviously, anything is possible, anything can happen, but the way that the reproductive system works is that your ovaries bring the egg through the fallopian tube into your uterus that gets ready to fertilize the egg when you receive sperm. In case you don't remember that from 4th grade sex ed, not everybody does, so that's fine. But essentially that entire system can't function that way without your fallopian tubes. So my primary care gave me a referral to a surgeon at my local university hospital, the University of Utah. And I've gone to the University of Utah hospital before. I went to the ER when I had E. coli. That's a whole different story, obviously. But I've only ever had positive experiences with the University of Utah. So I was very much open to seeing whatever doctor my PCP had referred me to. I think another concern that comes up whenever we talk about these types of procedures is that it's going to take a really long time to get in. I don't know if maybe I'm just really lucky or what, but it did not take me very long to get in. I think after I got the referral, it took me a month, maybe. I'll have to go back and look. If I can find out exactly how long it took me, then I will be sure to include that here. But my guess is like a month, maybe more than that, but I don't think it was more than that. So I was able to get an appointment for a telehealth visit with the doctor that was going to perform my surgery. And she basically briefed me on everything that the surgery would entail. So what she explained to me was that it was going to be a very minimally invasive surgery. They were going to make 3 incisions, 1 on either side of my stomach and then 1 in my belly button. And then they were going to go in through those incisions to remove the tubes and cauterize the area. At that time, I had in an IUD as birth control, and it was bringing me a lot of discomfort, and I was ready to get rid of it. So I opted at the same time as I was getting my tubes removed to also have the IUD removed. Now, something that my doctor told me was that I was able to keep the IUD if I wanted. For some people, there might be benefits to this, including like stopping your period. Maybe the hormonal regulation is working out for you, or any other number of reasons, maybe just convenience, because getting it out can be kind of a pain, especially if you don't do it while you're under general anesthesia, which usually you wouldn't. The only reason I did is because I was already under for the surgery. So my doctor did tell me that I could still keep in my IUD for the remainder of the time that it was good, which was still like 6 years or something. I had only just gotten it in pretty recently. But for me, it just wasn't working out. And so I asked them to remove it at the same time as they removed my tubes. And my doctor told me, of course, that they could do that. Now, at this point, some people might be confused because a lot of the people that I talked to didn't understand that I was keeping my ovaries and my uterus and only getting rid of my fallopian tubes. One of the biggest questions that I got was whether it would affect my period and my hormones, if it would put me into perimenopause or menopause. But the hormones mostly come from your ovaries, which again, I opted to keep. So there was no hormonal repercussion. I didn't go into menopause. It's nothing like that. Getting your tubes removed alone does not affect your hormones and does not affect your period. The only thing that my surgeon told me is that she had heard that some people had heavier cycles after they got the surgery, but that was really the only thing that she told me about it. My surgeon was great. She basically answered all of my questions before I even had to ask them. She just gave me a list of everything that was gonna happen and how it was gonna go, and asked me if I had any questions, and I told her that I didn't. She didn't ask me for a letter from my therapist or from a psychologist, and in fact, she told me, what she said was, if you say that you want to do this, then I believe you, and I'm not going to ask you a bunch of questions about it. I trust that this is what you want. The only thing she told me is that the regret rates for women under the age of 30 are the highest out of any age range for this surgery, but she actually did specifically mention that she didn't know what the regret rates were for trans men and that it was likely pretty different. When she mentioned this information, she didn't do it in a way that was condescending or as if she was trying to talk me out of it. It just sounded like something that she thought was worth mentioning. But yeah, she didn't question me any further about it or ask to talk to my therapist or my primary care or anything like that. So after we had the consultation, she told me that her team would reach out to schedule a surgery date. And they did pretty quickly. And the soonest that they could get me in was like 2 weeks after the consultation phone call. And for me, it was in January, so it was right after the holidays, before my birthday. It just was not a good time, and it felt very quick, which is honestly a pretty good complaint to have versus taking months and months to even be able to get in for a consultation. And again, I don't know if it's just because the University of Utah is incredible and has a lot of incredible practicing doctors, or if maybe it really is that we're just kind of convinced societally that it's going to be really hard to get an appointment for something like this. But everything happened very, very quickly. So when they told me the first available appointment was in January, I was like, I said, can we push it out just a little bit further? And they were like, yeah, of course. Like, when do you want to do it? So I opted to do it in March because I felt like that was a good slow time for me at work. And it was long enough after the holidays. So I set up an appointment. I believe the appointment was for March 6th, 2026. Leading up to the appointment, I did receive a few questionnaires through MyChart. This section sounds extremely sponsored, but I promise you 100% nobody is paying me to say this stuff about MyChart. I just feel very passionately about this app, which is the app that I use to keep in contact with all of my doctors and to be able to view my medical records, my billing history, pretty much everything. I have no affiliation with MyChart. However, if you have a doctor's office that offers connection through MyChart, I would highly, highly recommend it. You get your test results before the doctor has even looked at it. They're immediately sent to you. You can view your billing and itemized receipts for all of your bills. It's just a really, really great program. And I have both my primary care and the University of Utah hooked up through that app so I can view it all in one place. I can also directly message any of my providers to ask for information. So through MyChart, I received a few questionnaires just about medical history and that sort of thing. And we took care of that a couple of weeks in advance, a week in advance, something like that. And then I did receive a pre-surgery phone call to ask me a few questions and prepare me for a few things, and to let me know that I would be receiving all of the information for the date and time of my surgery, as well as all of the instructions. I'll probably put those up on the screen so that you can see exactly what they were. But essentially what they told me is that I had to stop consuming food at midnight the night before my surgery, and I had to stop consuming liquids 2 hours before my surgery. They told me to make sure to take any medications that I take on a regular basis. So for me, that's my antidepressants. And that was pretty much it. They gave me a list of liquids that I was allowed to drink. It was clear liquids, so I ended up having like half a cup of coffee. They actually called me in early to go for the surgery, so we got to have like 3 sips of my coffee, and then I had to stop because the surgery came sooner than I had expected it to. And at this point, I was nervous. I've never had a serious surgery before. I did have my wisdom teeth out when I was 21, but that's obviously a pretty different thing, even though I was under general anesthesia. So yeah, I was pretty nervous going into the hospital. My boyfriend drove me and took care of me the entire time, so I was very lucky to have him. They did tell me that I wouldn't be allowed to drive myself. I don't have a car anyway, so it doesn't matter. But they told me that I wouldn't be able to drive myself home from the hospital after I was on the anesthesia. And the information that I got through MyChart also told us where to park and the address of the hospital and all of the information that we might have needed to get there. So we arrived, we checked in, it was all super easy. Every step of the way, people were basically holding our hand, walking us through the hospital. And it all went very quickly. We weren't in the waiting room for very long. After we checked in, it was like 10 minutes, maybe less than that. And then they called us back and I got my own room. They had me completely undressed, including my underwear and everything, and then put on a robe because they were gonna have to obviously have access to my entire downstairs area. I had a few different nurses, a lot of different nurses actually, a lot of different medical people come in and check on me, ask me different questions, take care of different things for me. One nurse came in and put an IV in my hand and gave me fluids. She hooked me up to some fluids. Every step of the way, everybody was so nice. They all made me feel super comfortable and safe. They answered any questions that I had. They made sure to walk me through every step of what was happening, what they were checking, and what was gonna happen next. My surgeon, who I had only met over telehealth, also made sure to come in and introduce herself, as well as a few of the other people that were going to be in the OR with me. Even though I was literally not gonna even see them because I was gonna be knocked the fuck out. They came into my hospital room to introduce themselves and explain what their role was. I think we waited for about an hour in the room, my boyfriend and I. Luckily, I was allowed to have him back there with me. At first, I had him wait in the waiting room because I was like, it's fine, he can wait out there. Like, it's not gonna make that much of a difference anyway. But then as soon as I got back there, I was like, just kidding, I'm scared. And I asked the nurse to go get my boyfriend for me. So he waited in there with me and then waited in there for the entire time that I was under anesthesia. Anyway, once we were done waiting, the anesthesiologist came in with a nurse and he introduced himself to me. He explained what he was going to be doing and they took me to the OR. They told me to give my boyfriend a kiss and that I would see him in a couple of hours. And they wheeled me in my bed back into the OR. I felt like I was on the pit, even though it wasn't the emergency room. I felt like I was on a medical drama. So they wheeled me back there. Once I got into the room, they untied my robe so that I wouldn't be uncomfortable when I woke up from the knots kind of digging into my back. They helped to move me from my hospital bed into the operating bed, and then they talked to me the entire time, talked me through everything that was happening. They had me confirm my name and my date of birth to make sure they had the right patient and to confirm the procedure that we were doing. And then they put the oxygen mask on me. And the last thing I remember is them telling me that it was just oxygen and that I should just take deep breaths. And then I was out. And I think I had some dreams, but it basically felt like I fell asleep and then instantly woke up. It's interesting because when I woke up, I was expecting to feel pain in my uterine area where the procedure took place, because not only did they cut me open, but they also took out my IUD. So I was expecting a lot of pain there. Instead, what I felt was pain in my shoulder muscles, in my trap muscles. And pretty much immediately when they asked me if I was doing okay, I told them like my shoulders really hurt, my muscles really hurt. And they explained to me that during the procedure, they had to pump my stomach full of CO2. So not my stomach, like the organ, but right between my organs and my abdomen muscles, they had to pump it full of CO2 so that they were able to get in there to remove the fallopian tubes. So I was pumped open like a balloon. I can only imagine what that looked like. And the CO2 in my body essentially traveled from my abdomen muscles up into my shoulder muscles. And that's why I was feeling really sore. I felt like I had done like 1,000 shoulder shrugs and not stretched at all. I was kind of worried about what my reaction would be waking up from the anesthesia. They kept me in the OR for about 20 minutes. They brought me some juice and some applesauce. They gave me some fentanyl for the pain. Obviously, it was a very small amount of fentanyl. It's not the same thing that you get on the street. I didn't feel in the moment like it gave me a lot of relief, but I'm sure that if I didn't have the medicine that I would have been able to tell the difference. And pretty much the only thing that I was feeling from the after effects of the anesthesia was very emotional. I started crying almost immediately and told them that I wanted to see my boyfriend, and basically just kept crying until they finally brought me back to my hospital room. I don't know how long I was actually in the OR after I woke up, but I do know that I was under anesthesia for about 2 hours. So I got back to my room and I pretty much immediately had to pee. It's weird because they put a catheter in me, obviously, so I don't know, piss everywhere, I guess. I don't know. But they had a catheter in me. So when I woke up, even though they had already taken it out, it was, painful. Like I could feel where the catheter had been, and it was making me feel like I had to pee. So I went to the bathroom, and kind of the way that they can tell that you're ready to go home after surgery is to make sure that you're cognizant and you kind of know what's going on, but also that you can stand up by yourself and go to the bathroom by yourself. And the nurse was like, "Oh, you're doing this a lot quicker than most people do." And I was like, "Well, I have to pee all the time, so that's probably why." So that was pretty much it in the hospital. They brought out a wheelchair for me to sit in, and my boyfriend pushed me out to the parking lot where he brought the car around and then brought me out to the car in the wheelchair. Or maybe I walked to the car. Anyway, it doesn't matter. My doctor had told me when I was in the consultation that I was going to want at least 1 day off after the surgery. I ended up taking off 4 days in total, including the day that I got surgery. But I knew that I was going to have to be resting at least that first day and a half. Immediately, what me and my boyfriend did was go and get food because I hadn't eaten anything since midnight the night before. And my surgery was kind of late in the day, all things considered. It started at, I think 1 p.m. was when I checked into the hospital. So it had been a really long time since I had eaten. And luckily I had an appetite. I didn't think that I would, but I did. So we went and got some food, and I went home and just laid down. And he stayed with me for the next 24 hours. Most of the pain that I experienced in those 24 to 36 hours, it was just muscle pain. So when he brought me back from the hospital, walking from the car to my apartment, which granted the parking is terrible here, so it was far. Walking from the car to my apartment, I started to feel like the CO2 was like moving through my muscles, through my body. And I started to feel incredible pain in my trap muscles. Like so much pain that it was making me feel sick. I thought I was gonna throw up. But luckily I made it back to my apartment with my boyfriend's help. And I just spent the rest of the day, like I said, the next 24 to 36 hours, mostly in bed, getting up just to pee. I had him go to the store for me and all of that fun stuff, take care of me for the first day. Pretty much all of the pain that I was feeling was in my shoulders and in my abdomen from the muscle separation from my organs. It was super painful. I'm not gonna lie, it was super painful. I didn't really start to feel the incisions until later. Most of the pain that I felt, it was like I had done like 1,000 crunches. Like it just really, really felt like I had done an insane ab workout. So for the first day, I couldn't get up out of bed on my own. My boyfriend had to help me to stand up to go to the bathroom and all of that stuff. But slowly but surely, over the next couple of days, it started to get better. Unfortunately, by the time I returned to work, I had not had enough time off to fully heal. So I did leave early the first couple of days that I went back to work. So I think in total, it took me about 6 days before I was feeling up to par enough to complete a full shift. My job includes a lot of heavy lifting, so my restrictions were just that I couldn't lift anything that was more than, I want to say 15 pounds for the first 2 to 4 weeks after my surgery. So that's what I did for those first 2 weeks. I think it was 2 weeks. For the first 2 weeks, I didn't lift anything that was more than 15 pounds, but that was pretty much the only restriction. So if I bent down too much, then I would start to feel some pain in my abs. My job also includes a lot of reaching and like tiptoeing and stretching, and that was pretty painful. But after a little bit over a week, maybe I want to say a week and a half, it was like I was super sore, and then I went to bed and I woke up and I just felt better. And it had gotten slowly better over time, but it was like one day I just woke up and I was like, okay, I feel totally fine. There wasn't much aftercare to be done with the wounds because they were very small. I'll put a picture here of what they looked like right after. Instead of going for stitches, the doctors opted to super glue the wounds shut, which is interesting. I didn't know that that was something they did, but I was honestly glad that they did it because it really protected the wounds while they healed. And once the super glue came off, it was like the scab came off with it and it was basically a scar already. So instead of having just like exposed stitches on my stomach, it was like covered up with the super glue. So definitely if you're doing something like this and they give you that option, I would say to opt for the super glue. They didn't ask me, they just did it. But anyway, it's worth mentioning. They gave me a few things to help with the pain while I was recovering. Namely, they just gave me ibuprofen and Tylenol. They gave me some prescription ones. I don't think they're really any more, like the milligrams are any more than regular ibuprofen and Tylenol, but it was covered by my insurance. So all of the pills in total, I got like 4 pill bottles and I paid like $4. They did give me an opiate. They gave me oxycodone, 5 milligram immediate release tablets. And I think they gave me something like 10 or 15. So I did take a couple of those the first few days as I was healing, but they make you kind of constipated, and I was already kind of constipated from the catheter and the CO2 and everything because my organs were so disturbed. So I didn't take too many of the oxycodone, but it did help me a lot with the pain, especially that first couple of days. So yeah, after about a week and a half, I was feeling great. I came into work, I started lifting like normal, and I felt awesome. I was elated. I was so happy to finally have that procedure out of the way because I had been nervous about it ever since I had scheduled it. I had some concerns beforehand that I was going to feel regretful. Personally, I have a really hard time making permanent decisions, which I know is silly because I'm like covered in tattoos, but I have a really hard time making irreversible decisions. It stresses me out. It makes me really nervous. And so even though this is something that I know that I really want and that I knew that I really wanted, and I've always known that I really wanted it, I was still nervous that after the fact I was going to start having second thoughts. But when I tell you that I woke up and immediately I was so happy, and I have been so happy every day since. I have absolutely no regrets. Every time I think about the fact that I'm now permanently sterile, I never have to worry about getting pregnant ever again. I don't ever have to be on birth control again if I don't want to. Genuinely, I don't think I've ever made a better decision in my life. Now, before the surgery, I think I had had my IUD in for something like 6 months. It might have been longer than that, I'm not sure. But it was making me miserable. It was making me super depressed. The week before my period, I would get really, really depressed. It was also giving me pretty severe cramping, especially around the time of my period, but honestly just whenever. So I was pretty ready to get the IUD out, but I also wasn't sure what the actual effect on my period and hormones would be. Before I got my IUD, I was on testosterone. I had taken the pill several different times. I had taken the depot shot. So I had tried a lot of different types of birth control. Primarily for me, obviously I didn't want to get pregnant, but also I liked not having a period. I really hate having a period. It does give me dysphoria, but mainly it's just inconvenient as fuck and I hate having to deal with it. So up until my surgery, I hadn't had a regular period in over 10 years. It had been a really long time since I had had a normal period because I had been on so many different birth control and different hormones. So leading up to the surgery, I was kind of like, what's gonna happen when I get my IUD out and I'm basically on a complete hormone reset? I had my period the week leading up to my surgery. probably the day of my surgery was the last day that I was bleeding. So I had to wait a good 2.5, 3 weeks before my next period, and I was waiting. I was waiting to see if I was gonna be depressed. I was waiting to see if I was gonna feel that like deep sense of dread that I've been feeling before my period every time for the past like 4 months. And then my period came completely unexpectedly, and I felt great. Emotionally, I felt incredible. My body felt great. And honestly, I think I was just really excited and happy because I got my period without feeling super depressed, which meant that for me, it most likely was the IUD that was causing those emotions. And I didn't know if that was the root cause or if it was something else, but it turns out that that was the cause of those depressive episodes that I was having in the week leading up to my period. I had heard from my surgeon and I had read online that especially the first period after this surgery can be really intense, and it was, to say the least. Luckily, my cramps were not that bad. I did have some cramping. I was taking a lot of ibuprofen, which obviously helps to prevent the cramping. But for the most part, the cramps are not what I was dealing with. It was just the sheer amount of blood. There was so much blood. More by far than I have ever had in one single period. For the first time in my life, I bled through a tampon and through my underwear. I have never in my entire life filled up a tampon before. But yes, it was very, very intense. And luckily I didn't have tons of mood swings. I didn't have tons of cramps. It was just the blood. But now my period is over and physically I feel great. My scars are, I would say, about 90% healed. They probably have a little bit of a ways to go. They're very small. I'll insert a picture of them now that they're more healed. To me, having scars on my body isn't a big deal, so I didn't do anything to prevent them. I actually kind of think scars are cool. You could probably use something like cocoa butter or other scar prevention methods to help the scars to not be so visible, but they're honestly so small, you really can't even tell that they're there. I'm back to lifting and bending and stretching normally. I feel great. I can do all of the activities that I could before the surgery. Absolutely no issues at all. So I am super, super happy health-wise. Now let's get into the cost of everything. So when you have health insurance, something that you can do is to call your insurance and ask them about certain procedures or medications to see what's covered and how much you might have to pay out of pocket. I did not do that before the surgery. I didn't call my insurance before the procedure. I was like, we'll just see what the damage is afterward and we will go from there. So that's kind of the information that I've been waiting on before I made this video. And recently I checked my insurance information for the first time since the surgery. I had 2 separate claims, technically 3 if you count the one that was for the medication, but 2 main claims. One was for the anesthesiologist and one was for the surgery itself. The anesthesiologist was something like $1,400. I'll put all of the information up here. The anesthesiologist was something like $1,400 and the surgery was something like $4,100. My insurance covered all of it. I don't owe a single penny for any part of the operation that I had. The anesthesia was fully covered. The IUD removal was fully covered. $200 without insurance, by the way, which is crazy. And the surgery itself, completely covered. My insurance took care of everything. The insurance that I have is Blue Cross Blue Shield. I get the insurance through my work. Like I said, I pay $75 bi-weekly. It just comes straight out of my paycheck, so I don't have to worry about like sending them checks or anything like that. Again, I just want to recognize I am extremely lucky, and I know how lucky I am to be in a position where I have access to getting health insurance, where it's an affordable price, and where I can afford to pay it. Because for some people, even if it was only $75 bi-weekly, they wouldn't be able to spare that money. And I am very, very lucky that I'm in a position where I can. Now, to be clear, I worked very hard to get to that position. I don't speak to my parents. I don't have like some secret money source or some like rich family that's taking care of me and like helping me coast through life. I am lucky to have some family members who have helped me out of really tight spots and who support me if I'm like gonna be homeless. Like again, when I got E. coli, I had some relatives who floated me a very large amount of money so that I could take time off of work and still be able to pay my rent. But other than very few exceptions like that, I pay for all my own shit. I have my own full-time job where I make something like 20 bucks an hour. I worked really hard to get into the position that I'm in right now. I live in my very own apartment that I pay for all by myself. I don't have a car, which I mentioned earlier, because it's expensive, but I chose to make that sacrifice because I would rather have no car and live in an apartment by myself versus live with roommates and have a car. But my point is, I don't have like the fanciest insurance ever. A lot of the choices that I made when I was getting my insurance, I made the absolute cheapest possible ones. There were certain things that I knew I was going to need because I go to therapy bi-weekly and I'm on 3 different medications that I take every morning. So I knew that I was going to need certain things in order to be able to live the life that I had been living before I had to get on my own insurance, because I was on my parents' up until I turned 26 this year and had to get on my own. And I did it. I went and got this procedure and it was completely paid for. Literally no questions asked. I know that it's not this easy for everybody. And I know that the reason that the horror stories around reproductive health and surgeries and sterilization, those stories exist for a reason, because there are people who are not as privileged as me and who haven't been able to get as lucky as I have. But my entire point in making this video is to hopefully encourage anybody who has been thinking about getting a procedure like this to at least try. Don't think to yourself that this is something that can only happen for other people or that it's impossible for you. If you're in a position where you have medical insurance for yourself, go to your local Planned Parenthood and find a primary care physician. They will help you to find a doctor. Get an appointment with that doctor, talk to them about the surgeries and procedures that you need and what you want. Find somebody that listens to you, that believes you and trusts you. And I know that it's exhausting to try and try again when you don't get lucky with a doctor the first time, but these things can happen for you. You can make them happen. They're not as impossible as everybody wants you to think they are. While again, there is a reason that these horror stories exist, it's also true that society has a lot of reasons to want you to believe that you cannot take charge of your own reproductive health. And it just isn't true. You can do it. Something else that I want to acknowledge before I end this video is that a pretty large part of the reason that I'm able to find doctors that believe me and trust me and give me the things that I say that I need is, first of all, because they're all female doctors. I don't work with any male doctors. I will refuse to go to a doctor before I will go to a male doctor. So that's number one. But number two is that I am white. If that's not obvious, I am white. And that is a huge, huge advantage when it comes to getting the medical care that you need. There's not really anything super profound that I can add to the conversation around medicine as it relates to race, and especially Black women, but all women of color. The only thing that I can say is that it's really important to acknowledge that my story could be completely different if I were a Black person instead of a white person. I would still encourage people of all races and creeds, all backgrounds, to at least see what you can find in your area, at least try to find these resources, because it is possible. But I want to acknowledge that, again, I am very privileged, and this really could have gone differently for me if I were not a white person. It's really unfortunate and upsetting to think about the way that our medical systems that we have in place treat Black women. The mortality rate for Black pregnant women is, I don't know the exact statistics, but insanely higher than it is for white women. So all I can really speak to is my experience and the way that this went for me, which was that I just tried and I was able to figure it out. And I never thought that I was going to be able to figure something like this out. Everything that I heard about it was like, oh, it's impossible to get your tubes tied. It's impossible. It's so hard to get your tubes tied before you're 30. I'm 26 years old and I did it. I got my fallopian tubes completely removed. And now, unless I go get IVF, I will never be pregnant. Ever. If you found this story interesting or you took something away from it, feel free to subscribe to my channel. I don't get any AdSense or anything like that from these videos. I just enjoy talking to my camera sometimes. So if you're into that, then, feel free to subscribe. And if anybody has any questions please leave them down below. I am happy to answer pretty much anything. Hopefully I didn't leave anything out of this video and I got most of the details. Thank you so much for watching. I'm really happy that I was able to finally make this video with an all-inclusive and transparent conversation about my experience, how much it cost me, and everything else that kind of came with this surgery. This was the best decision that I've ever made in my entire life. I do not think that I have ever been happier with a decision than I am with the decision that I made to get my fallopian tubes removed. Again, thanks for watching, and I'll see you